Have you ever lain awake at night, with your heart racing, afraid that something might go wrong with your pregnancy? You're not alone. Maybe it's the fear of a miscarriage, maybe you haven't felt the baby move today. Maybe you're terrified of the pain of labor, or of giving birth too early, or not having enough milk after the baby is born. These fears are real. They're common, and if left unspoken, they can take over your pregnancy experience. But here's the good news. Most of the fears pregnant women face can be handled often more easily than you think. In this video, we're going to walk you through the most common fears in pregnancy, the risks if they actually happen, and most importantly, the facts, the science, and the gentle strategies that can help you feel safe again. And we're here, as maternal health experts, to help you through it all. So hit that subscribe button right now, so you never miss a piece of honest, science-backed guidance for your motherhood journey. Now let's get into it. Fear number 1. What if I have a miscarriage? This is the number one fear in early pregnancy. Every cramp, every bit of spotting, it sends your heart into panic. You search for signs. You imagine the worst. The risk? While miscarriage is most likely in the first trimester, the actual numbers may surprise you. If you've seen a heartbeat on an ultrasound, your risk drops dramatically, to less than 5%. The good news? You can do things that reduce risk even further. Rest when you feel tired. Avoid lifting heavy things. Stay hydrated, and don't hesitate to see your doctor if you spot bleeding. Early checks can offer huge reassurance. Miscarriage fear is real, but it doesn't have to own your pregnancy. Fear number 2. What if my baby isn't growing properly? You might worry your belly looks too small, or that you're not gaining enough weight. You wonder if the baby is getting all the nutrients it needs. The risk? There is a condition called intrauterine growth restriction, but it's not common in healthy pregnancies. It's more often linked to smoking, high blood pressure, or unmanaged diabetes. The good news? Doctors measure your baby's growth at every visit. Ultrasounds can track weight and blood flow. And your nutrition matters more than you think. Eat plenty of protein, iron, omega-3s, and whole grains. A healthy diet, regular prenatal visits, and trusting that your baby is growing just as they're meant to, that's your power. Fear number 3. I'm terrified of the pain of childbirth. You've heard the stories, you've seen the videos, screaming, crying, trauma. You ask yourself, will I survive the pain? The risk? Yes, labor hurts, but pain management has come a long way. You are not powerless. The good news? You can take control. Learn breathing techniques, try water labor. Consider an epidural or other pain relief. You can even hire a doula for emotional support. Fear fades when you have a plan. Pain is real, but so is your strength and the tools to help you. Fear number 4. What if my baby has a birth defect? This is a quiet fear. Many women don't talk about it, but they think about it a lot. The risk? Most babies are born healthy. Congenital issues occur in less than 3% of births, and many are treatable. The good news? Today's prenatal testing is incredibly advanced. You can do blood tests like NIPT or structural scans at 20 weeks to catch anything early. If something is found, you'll get expert care and counseling. Early knowledge brings clarity and options. You're not in this alone. Fear number 5. What if I go into labor too early? Preterm birth is another worry, especially for moms who've had complications before. The risk? Preterm labor affects about 10% of pregnancies worldwide, but with monitoring, it can often be prevented or delayed. The good news? Doctors can use medications to calm early contractions. If necessary, they'll give steroids to speed up the baby's lung development. Bed rest, hydration, and avoiding stress can also help. So if you're feeling pressure or contractions before 37 weeks, don't wait. Early action makes all the difference. Fear number 6. What if I lose my career or my body? Maybe you worry about how your boss will treat your pregnancy, or how your body will look after birth. Will you ever feel strong or confident again? The risk? Yes, pregnancy can bring changes to your identity, but you're not disappearing. You're evolving. The good news? Many women return to work stronger than before, with clarity and purpose. And your body, it won't be the same, but it will be yours and it will recover. With support, planning, and self-kindness, you can be a mother and a woman who thrives. Fear number 7. I'm scared of what people will say. Why are you still working? Why are you gaining so much weight? Why aren't you eating that? Unwanted opinions are everywhere, from neighbors, relatives, even strangers. The risk? Constant judgment creates stress, and that stress hurts you and the baby. The good news? You have the right to set boundaries. Say no, unfollow, stop explaining, and instead, surround yourself with people who respect your choices. You don't owe anyone an explanation for how you carry your pregnancy. Fear number 8. What if I can't breastfeed? You want to breastfeed, but you've heard horror stories, low supply, latch problems, cracked nipples. The risk? Breastfeeding challenges are common, but most can be overcome. The good news? If you get support early, from a lactation consultant, from your hospital, from trusted sources, you have a much better chance of success. Feed on demand. Don't wait for baby to cry. Rest, eat well, and give yourself grace. And remember, fed is best. Your baby needs you calm more than perfect. Pregnancy is a wild, emotional, beautiful ride. And fear is part of that ride, but fear doesn't get the final say. You do. With knowledge, support, and compassion, you can move through fear, into power, into peace, into motherhood. So thank you for watching. If any of these fears spoke to you, tell us in the comments. We're building a safe space here for moms like you. And don't forget to subscribe so you never feel alone on this journey again. We'll see you in the next video.